Welcome, welcome. We are so glad that you are joining us today. We wanted to introduce something to you. So as you see on all of our backgrounds, we are all the core collaborators, meaning we were the folks that came together and helped to bring the Kansas Racial Equity Collaborative to life. And so what we are doing today is we are about to engage in courageous collaborative conversations. And before we begin, what we're going to do is we're going to go ahead and introduce who we are and the agencies that we are representing. And I am Chanel Dupree. I am a representative of the Department for Children and Families, the Kansas City Regional Director.
And good afternoon, morning, or evening, whichever time you're looking at this. I am Brandy Turner. I'm the Diversity, Equity, and Inclusion Officer for the Department of Children and Families.
My name is Abby Fry, and I work with CarePortal in Kansas City.
Hi, my name is Ashley Smith. I also work with CarePortal, and I'm the Child and Family Advocate.
Hi, everyone. I'm Becky Aiken. I'm an associate professor at the University of Kansas School of Social Welfare.
Hi, my name is Kalechi Wright, and I am a doctoral student at the School of Social Welfare at University of Kansas and a graduate research assistant.
Hi, my name is Pega Naomi Jimenez. I'm an associate researcher at the KU School of Social Welfare.
Hi, everyone. My name is Sarah McCall, and I'm a project manager at the University of Kansas School of Social Welfare.
We are all so excited about this collaborative. How did this start?
So it happened actually that I and Chanel just were chatting over coffee one day, just as friends and thinking about the worlds that we live in and the work that we do, and just thinking about what are some of the gaps that we see. And one of those gaps that we saw is just the disproportionality issues in child welfare and just how and are those things being addressed. And as we sat there, we chatted for a minute and thought, is there anything that we can do about that? I don't know, maybe. And we kind of just had some different ideas. And in my head, it was like maybe 10 people sitting around a table chatting about child welfare and just how we see things. And it's kind of grown into this amazing collaboration.
Yeah, and so Abby was like, you know, we just need to be in a room. And I was like, this needs to be a statewide conversation, right? We need to have a statewide conversation, a statewide learning journey. And as Abby and I were talking and just bouncing ideas off of one another, so excited to meet and talk. And the piece that I felt, that we felt we needed to incorporate was work that other folks were doing. And from my work with DCF and in connection to the University of Kansas, Dr. Becky Aiken is leading a federal project, a federal grant called Kansas Strong. And so there is a piece in that multifaceted federal grant where they are specifically looking at racial disproportionality for Wyandotte County and for youth 0 to 5, children aged 0 to 5. And so there was a lot of work already being done surrounding that, and thought that it just made sense to reach out and see if they would want to be a part, which they did. Yay.
So working together, we came up with kind of a four-part initiative. The first thing we're doing is 4 lectures, online lectures. We're bringing in national speakers to address a range of topics related to racial disproportionality and disparities in child welfare. Second, we're doing a listserv where we can share resources with people who are interested in it. Third, we have a website where people can get information and also access some of those resources and register for the online lectures. And finally, in the spring of 22, we're going to have an in-person symposium.
This is very exciting, Becky. And this is so important to me because ultimately this is about the children. We're talking about the system and how the system serves our children. And I personally, I have a Black child in a community, and I want him to grow up feeling valued and safe wherever he is. And I imagine that's how other parents feel. So I'm so very excited about what we're doing, and I can't wait to see how it turns out.
I agree. And I didn't necessarily grow up with people in the system, but I definitely do a lot of children who were raised by grandparents and aunts and uncles in the Black community. And it's definitely a hot topic or a very important topic to find out what the racial impact is on the children who end up in the system, and really just try to figure out like why there is such a belief that there's an innate difficulty in the Black community and wanting to remove them from their families and from their communities. So that is part of the conversation that I'm really interested in, and finding the supports and encouragement to keep those families together.
And I had the privilege of getting to interview some Black parents who are involved in the child welfare system, which was a spinoff from some of the research that Chanel mentioned with Kansas Strong. And I see that this kind of labor and effort really gives a voice for Black parents who have had direct involvement and their families have been detrimentally affected by racial disproportionality and racial disparities in the child welfare system.
I think that oftentimes, as we're all learning together, lots of times we sit and we hear people talk about things, maybe we have discussions, but what I really hope is that people actually walk away from this learning journey with practical things that they can change. I want us all to see how, from where I sit, there's something that I can actually do to affect change. And I think that that happens in this collaborative environment. Oftentimes in this work, the helpers kind of work in these silos doing their own things. But as we collaborate together, I think that we can affect true change.
I love that so much, Abby. What I want people to walk away from is really being able to reimagine the system of child welfare and how we can really move towards how do we support Black and Brown families better than we have been, and what does that really look like for them, versus prescribing what we think supports should be, but really listening and hearing their voices and their lived experiences to support them the way that they need us to.
I agree, Pega. I hope that that attendees understand the systemic nature of racism and how our histories, policies, and practices have perpetuated the harm. The other part of that is that I hope that we walk away from this as mandated reporters, child welfare professionals, researchers, lawmakers, having the tools, having shared language, and an understanding for how we move forward and improve.
I'll add just one more thing to that. One of the things that's really struck me as a researcher is that you can look across the data over time, over places, different states, and we continue to find that Black and Brown children have much worse outcomes in our child welfare system. And what's really striking about that is that our states and our counties are really different from one another, but inside of those differences, the thing that's the same is that Black and Brown children and families have those poor outcomes. So something has to be happening at a systemic level that we have to address now.
And Becky, I love how you tied in. I love what everyone said. And what I really want for folks to walk away with is understanding that this is a learning journey. And in any learning journey, there's going to be moments where you may have to hear it more than once, where you need to think deeply about it, and where you need to look at the data and look at the information to fully grasp what's happening, and then listen to the lived experiences, to the stories of people who have gone through this and who are experiencing it. And so we're inviting you to be a part of this learning journey, understanding that it's not going to be easy. It's not going to be a how's the weather conversation, but we're having courageous conversations and we're being very intentional about it. And we need you. This is a multidisciplinary problem. This has to be a multidisciplinary solution. And so you're in the room for a reason. If you're watching this, you're here for a reason. And whatever role you're in, you can make change. If Abby and I thought of this entire collaborative and brought in excellent partners with KU over coffee, like how much more can you do with just having conversations and thinking through things that feel really big, but take folks to just take one step at a time. And so that's what we're inviting for you to do today, to take one step at a time with us, to go on this learning journey. And we're so excited to go along this with you.